Hello everyone, welcome. So we have talked about various diseases in man and now we'll be talking about few more diseases in man. So uh helminth disease, which is first one is ascariasis. So ascariasis is caused by a pathogen which is an intestinal parasite which is ascaris. The mode of transmission is soil, water, vegetable, fruits, etc., contaminated with feces containing eggs and parasite. Symptoms is internal bleeding. You might have muscular pains, fever, anemia, and blockage of intestinal passage. So if you see that we might have we have the small intestine, and what is happening inside the small intestine, so we are eating the food, and there might be a small worm that might be there. So this worms, they will grow up and they will form the adult worms, okay, from the eggs are something that you might have taken in. So now you might have pulmonary migrations or allergic eosinophilia, gut obstructions, or malnutrition. So that is when you will go ahead and there might be a problem in the excretion. Okay. Next, helminth disease is filariasis. Filariasis is what? Filariasis is caused by filarial worm or Wuchereria. Wuchereria bancrofti or Wuchereria malai. So Wuchereria malai or Wuchereria bancrofti is going to cause it. Mode of transmission is bite of female Culex mosquito. Symptoms are filarial worms live in the lymphatic vessels, usually in the lower limbs. It causes chronic inflammation of organs in which they live for many years. Limbs and genital organs may be deformed. So there it might be a deformation of the legs. It might become a very fat or very big one. That is basically a disease that will be caused. Next, I'm coming to a fungal disease, which is ringworm. Ringworm, it can be microsporum, trichophyton, epidermophyton. So all these are the pathogens. They are seen in the groin or between the toes. Okay, so they are found there. So there might be microsporum that might be there, or trichophyton is like this, or epiphyton is this. Now here, the mode of transmission is from soils or by using towels, clothes, combs, etc. Heat and moisture help the fungi to grow. So basically you don't dry the areas and all those things. So that might cause a fungal infection or a ringworm. Okay, not washing hands properly, dermophyte fungi is there. Close contact with those who are in the infected person, damp skin, so for a very long time, that causes infection. So if you see this, the symptoms might be dry, scaly lesions on skins, nails, scalp, etc. Intense itching would be there. So ringworm is something that I guess most of us would have faced some time or other. So now the common infectious disease in man, we have one for the personal hygiene. So prevention and control of diseases is very important, where you need to keep the body clean and use clean drinking water, food, etc. So a public hygiene also is very important, so that you have a proper disposal of waste and excreta, periodic cleaning and disinfection of water reservoirs, pools, cesspools and tanks. Avoid contact with infected person or their belongings to control airborne diseases. Standard practices of hygiene is in public catering. So hygiene should be followed and control and eliminate vectors, example mosquitoes. Next, we have uh, a control and elimination of vectors. So you should avoid stagnating of water, because once you have the water stagnated in, say, tubs or in, dug in the dug areas, or stagnated water after the rainy season, all this causes the larva to grow. Okay, so mosquitoes larvas will go ahead. So during malaria or dengue, we have people coming around the home and stating that don't let water get stagnated for very long time. So there might be the larva uh, which will grow in the stagnated water. Regular cleaning of the household coolers, it is also important, because otherwise there will be the deposition, and then after that the mosquito larvae will grow in the stagnated water which is there in the cooler. Okay. And you can also eliminate the vector by use of mosquito nets. When you sleep, or the way babies sleep, we have a mosquito net cover, sleep within a mosquito net, so that the mosquito, or use mosquito repellents so that the mosquito does not come and bite you. Or introduce larvivorous fishes like gambusia in the ponds. So if you have a pond, then let us have gambusia or guppy fish, so that they will eat up all the larvae. You can spray insecticides in the ditches, drainage, and swamps. So there are insect killers wherever there is stagnated water. Regular use water, there might be ponds or there might be pools. So you can always go ahead and spray insecticides so that the larva does not grow. And provide doors and windows with wire mesh so that the mosquitoes do not enter, because we are going to save ourselves from malaria, filariasis, dengue fever, and chikungunya if we keep mosquitoes away from us. Then vaccines and immunization is very important. It helps to control the diseases like smallpox, polio, diphtheria, pneumonia, and tetanus. Drugs like antibiotics also help in the treatment of various diseases. All right. So this is how I can avoid the diseases in human beings, or the common infectious diseases that we have. Thank you.